Dr. Arroyo, when most people think about cardiology, they think about heart attacks. And St. Bernard's has been fortunate in that we have been awarded the American Heart Association STEMI Gold Plus STEMI Award. This will be our fourth year for 2017, and we're the only receiving hospital in the state of Arkansas to receive that award. If you could talk a little bit about heart attacks and STEMIs, and also the importance of calling 911, which is our real important focus this year.
Yes. So what we call a STEMI is a big heart attack. It's a bad heart attack. It's when an artery that goes to the heart blocks completely with clot. And, you remember the map that I showed not that long ago. So the statistics, unfortunately, still about 50% of people that have heart attacks will die at home or before they reach the hospital, which is why that number is so impressive. So when somebody is having a heart attack, specifically a STEMI, the way that this goes, you call the ambulance, or should call 911 in the ambulance. The ambulance gets to your house, immediately does an electrocardiogram. If it's one of these bad heart attacks, immediately a cascade of events gets triggered. As they take the first EKG, everybody in the network gets activated. The physician, the nurses that come to the cath lab with us, the ER, everybody knows about it to try to make this as quickly as possible. We know that the quicker that we can get the person to the cath lab table from the onset of symptoms, the better chances we're going to have to save that person's life. So it's not only a one-person job. It's not the doctor or the people that are working with me, but it also is the emergency room. The emergency rooms in the hospitals around that recognize this type of heart attack very quickly is the first responders, EMS, that will do an EKG very promptly on these patients as soon as they know that they're having chest pain. So it's a network. It's a STEMI network. That's what we call it. And our network has gotten the Gold Plus Award 4 years in a row. We're the only hospital in the state that actually has that recognition. So that recognizes the hard work of everybody. Everybody that recognizes the STEMI very early on, the ERs, the doctors, everyone. And we can still do better. As far as how quickly we can get a person to our hospital, how quickly we can run the ambulance, we really can't get any quicker than we are already. So the next step is to try to go to the community and tell patients that if you think you're having a heart attack, if you're having symptoms of chest pain that are sudden onset or sudden onset of shortness of breath, all these things don't need to be ignored. The sooner that we can get you to the hospital, the sooner that we can work on you, the better you're going to do. People that sit on it for 1 hour, 2 hours a day, they tend to be the ones that don't do well and become, unfortunately, a statistic of people that die at home with this problem.